How do oral therapies fit into your lymphoma treatment regimen? Imagine having a treatment option that you can take at home, giving you more control and convenience in managing lymphoma. Oral therapies have become an important part of treatment plans for non-Hodgkin lymphoma, especially for slow-growing types. They are often used alongside or instead of traditional treatments like chemotherapy given through Regimen 4. These pills or capsules can be taken daily or on a specific schedule, reducing the need for frequent visits to the clinic for infusions or injections. Most oral therapies for lymphoma are targeted treatments or certain immunotherapies. Unlike traditional chemotherapy that attacks all rapidly dividing cells and can cause side effects like hair loss or nausea, targeted oral drugs focus on specific proteins or genes found mainly in lymphoma cells. This precision often means fewer side effects and better tolerability for many patients. For example, drugs like acalabrutinib, ibrutinib, duvelisib, idlasib, lenalidomide, pirtobrutinib, tazemetostat, venetoclax, and zanubrutinib are all FDA-approved oral medications used for different types of indolent non-Hodgkin lymphoma. They work by blocking signals that help cancer cells grow or by boosting the immune system to fight the disease. In practice, oral therapies can be used in several ways. They might be part of the initial treatment plan, especially when combined with monoclonal antibodies like rituximab. They are also helpful for patients who cannot tolerate intensive chemotherapy because of age, other health conditions, or previous side effects. For some patients whose lymphoma has come back or not responded to initial treatments, oral drugs often serve as additional options. They can also be used to keep the disease under control over time, offering a less invasive and more manageable approach. Some patients who are not fit for standard chemotherapy or who live in areas with limited healthcare resources might benefit from low-dose, continuous oral chemotherapy, known as metronomic therapy. This approach can help control symptoms and slow disease progression with fewer side effects and lower costs. Of course, like all treatments, oral therapies come with potential risks. Side effects can include increased chances of infections, changes in blood cell counts, gastrointestinal issues, or effects on the heart and blood pressure. Because of these risks, healthcare providers carefully monitor patients on these medications, adjusting doses or switching treatments as needed. Steroids are sometimes prescribed along with oral therapies to improve their effectiveness, but they also require careful management to avoid side effects like weight gain or high blood pressure. In summary, oral therapies are a valuable addition to the options for treating non-Hodgkin lymphoma. They offer targeted, convenient, and often better tolerated choices that can be used alone or with other treatments. They help expand the possibilities for managing the disease, especially for those who need less intensive or more manageable treatment plans. However, every patient's situation is unique, and decisions about using these drugs are made based on the lymphoma subtype, how advanced the disease is, the patient's overall health, and previous treatments, all guided by experienced oncology specialists. Always consult your healthcare team to find the best approach for your individual needs.